Good evening. Welcome to the second webinar of the Caribbean Sepsis and AMR Alliance. I am your host, Dr. Tennille, a lecturer at the School of Veterinary Medicine at the University of the West Indies at the St. Augustine campus. We're very happy to have this second webinar, which is related to the veterinary field. And our topic today is sepsis and AMR in veterinary medicine, implications for animal and human health. Today, we have two dynamic speakers, Dr. Sani Mohammed and Dr. Paul Cadogan. Just before we begin, I'd like to let you know that we will be taking questions at the end of the both presentations. But also we would like you to post your questions in the chat and I will read them out and then we'll have the speakers answer them. Okay, you can post questions at any time during the presentations or during the question and answer session, which will be at the end. So thank you very much for attending. And without further ado, I'd like to introduce our first speaker, Dr. Sani Mohammed. Mohammed Sani Ismaila is a veterinarian who specializes in veterinary pharmacology and toxicology. He is a lecturer in the Department of Basic Veterinary Sciences, School of Veterinary Medicine, Faculty of Medical Sciences, UE. He obtained his DVM and Masters of Science degree at Usmanu Danfodio University in Sokoto, Nigeria, in 2004 and 2010, respectively. He graduated from the University of Putra, Malaysia, where he obtained a PhD in pharmacology. He has worked on the exploration of germinated brown rice as a possible replacement for hormone therapy in rats, and his areas of interest include molecular pharmacology and toxicology, alternative therapy, nutri-pharmacology, and nanodelivery. Dr. Mohammed's presentation is titled Antibiotic Misuse in Veterinary Practice and Its Impact on Public Health. Dr. Mohammed.
Thank you so much and good afternoon, good evening, everyone. Thank you, Tennille, for your introduction on this second webinar for the Caribbean Sepsis and Antimicrobial Alliance. I'm happy today to have you, and my topic of presentation for this webinar today is on antibiotic misuse in veterinary practice and its impact on public health. So without wasting much time, I will introduce us to my presentation overview today. I will start with a brief introduction on antimicrobial misuse, then the causes and spread of antimicrobial resistance. Then I will explain briefly on the type of resistance we have, then the mechanism of resistance. Then I will briefly give an insight on the situation in the Caribbean region, then give a little glimpse on ways to minimize the spread of resistance. So these are our learning outcomes for today. Participants will be able to identify different mechanisms of antimicrobial resistance, and our participants will be able to use the proper knowledge on the rationale use of antimicrobial to decrease the spread of resistance in veterinary practice and in human medicine in general. So before we proceed, I want to share a video, a 2-minute video, for us to have a glimpse.
It is a top priority for Welsh farmers and vets to keep farm animals healthy and safe by providing them with the best quality care. Antibiotics are an essential tool for treating potentially serious bacterial infections in farm animals. However, the emergence of antibiotic resistance poses a major threat for animals, people, and the environment. Misuse of antibiotics can reduce their effectiveness, meaning resistance to these important medicines can build up. But by taking action now, we can help reduce this burden and protect antibiotics for future use. Arwine DGC is a project set up to reduce antibiotic resistance by supporting farmers, vets and equine owners to reduce the need to use antibiotics. Through extensive research, with data collected from over 4,500 farms, we're investigating antibiotic use across Wales. We carry out environmental sampling on farms to explore and evaluate the spread of antibiotic resistance. We provide support for vets to help them set high standards when prescribing antibiotics for farm animals and horses to prevent unnecessary use. Using novel technology and precision agriculture, we are helping farmers reduce the need to use antibiotics. We are at the forefront of promoting responsible antibiotic use on Welsh farms by connecting industry experts and researchers with farmers and vets. By taking a One Health approach, we're finding solutions that protect animals, people, and the planet. For more information, please visit our website and follow us on social media using the hashtag @ArwainDGC.
Okay, thank you so much for that. So as you have all seen on this video on antimicrobial resistance. So let me throw a question before I proceed on one question on pre-assessment for this webinar. So which one of the following types of antimicrobial resistance produces clinical problem? You can keep your answer on the chat. Is it natural resistance or acquired resistance? So acquired resistance is the type of resistance that give a lot of problem in the field. So antimicrobial misuse in veterinary practice is a significant concern that has a lot of implication, not only in veterinary medicine, also in public health and in human health generally. And if you look at it generally, it involves inappropriate use of antimicrobials or overuse of this agent or misuse of them. So the point of view here is that whatever we are going to discuss on antimicrobial resistance lay upon these three things, either inappropriate use, overuse, or misuse of antibiotics in animals. And this overuse, inappropriate use, and misuse is portrayed by overprescription by veterinarians or human medical doctors, incorrect dosage or duration, that is to say, if antibiotics are prescribed now, the patient or the owner, the client, will not complete the dosage or the frequency of administration of the drug. The use of antibiotics in healthy animals, like in veterinary practice, that we use a lot of antibiotic in prophylactics treatment and as food additives, whereby antibiotics, especially the broad-spectrum antibiotics, are used in animal feeds, in fish feeds, in pig's feed, and other ruminant feeds. Inappropriate choice of antibiotics, for instance, without proper diagnosis, inappropriate, instead of veterinarians using narrow-spectrum antibiotics, using broad-spectrum in each and every case that come to the clinic, and improper diagnostic procedures without antimicrobial tests or tests to confirm your diagnosis before embarking on antimicrobial treatment. So all this leads to antimicrobial resistance. So if you can see whatever in this picture, antimicrobial resistance occur whether in veterinary medicine or in human medicine is almost the same, either by medical practitioners or by veterinarians not using the antibiotics in proper way or a lack of diagnosis before treatment. So what is antimicrobial resistance? It's a situation whereby microbes that we treat with a certain antibiotic now resist with time, develop some mechanism to resist those antimicrobials that have effect on them before. So this organism now develops some mechanism to resist the effect of those antimicrobials. And this poses a grave and growing global problem. So in a statement by a World Health Organization report released in April 2014 stated that this antimicrobial resistance is a serious threat, is not longer a prediction for the future. It is happening right now in every region of the world and has the potential of effect anywhere, of any age, in any country. So antimicrobial resistance is becoming a problem and threat to the world. Let us see a brief way on which antimicrobial resistance can jump from one species to the other. From the figure here, you can see it is easy to have interconnection between people, animals, and the environment. These three things make it easy for antibiotic-resistant bacteria to jump from one species to another. For instance, a resistant strain living in the soil could travel through runoff water and to human via drinking the water, recreational swimming, multiple routes of exchange profile in the evolution and spread of resistance. The fish that swim in the water, whereby droplets from these animals are being carried away by the rainwater to the river, and humans will consume this fresh fish without knowing that there are deposits of some antimicrobials that are used in these animals. So resistance will spread from environment, from animal droppings, which contain antimicrobials, to aquaculture, to our homes, where this antimicrobial resistance will be spread, thereby contributing to non-effect of these antimicrobials when used in humans. So how antibiotic resistance happen? If you look at this picture, lots of germs that we know in our body, a few are drug resistance. So we have what we call commensals, which are normal bacteria in our body, and we have some few which are resistant to antimicrobials. By the time you administer an antibiotic to an animal or a human being, those antimicrobials will work not only on the bacteria causing the problem or bacteria causing the infection, also some normal flora of the bacteria will be affected, thereby reducing the population of these commensals, which are normal bacteria that works positively in our body. So you will be left with bacteria that is resistant to that antibiotic that is used. So this antibiotic resistant bacteria that remain in our body now transfer this resistant strain to other bacteria that are in our body, which are in small concentration. In the fourth stage, now this bacteria will acquire resistant genes from this resistant bacteria. So in the lower part of the diagram, you will see that the resistant trait is divided into two, how it spread. If you look at in my left hand, you will see animal gets antibiotics and develop resistant bacteria in their gut after treatment. So this animal now will pass their droplets, or their they will be slaughtered if the slaughter withdrawal period is not exercised. That is the time by which the antimicrobial will be flushed out of the body. So this animal will be taken to abattoir, and or milk they produce will be passing the resistant bacteria. Thereby, when humans consume the meat or milk from these animals, will be carrying along with them the resistant genes or the resistant organisms. On the other hand, a gentleman known as George now gets antibiotics injections or antibiotic treatments when developed bacteria in his gut resistance. He will pass the resistant trend, whether in the hospital or at home, to his neighbors and relatives. Thereby, the cycle continues. This is how we have a kind of spread of antimicrobial resistance from animals to human and vice versa. Okay, we have two main types of resistance. Resistance can be either natural or acquired. As I have just said, natural resistance doesn't pose any clinical threat, but acquired resistance is the resistance that happens when one bacteria passes the resistant trend to another bacteria, and when you use those drugs, the organism will develop resistance. Natural resistance always we know is natural due to the fact that some bacteria doesn't have the ability, or some microbes have always been resistant to certain antimicrobials because they lack the metabolic process that those antimicrobial works, or they lack the targets. For example, if you take gram-negative organism, they are naturally not affected by penicillin. So if you have a gram-negative infection in an animal and you are given penicillin, so it's like you are wasting time, or we are just not doing anything because there is no penicillin binding proteins for penicillin to work. So the same thing in tuberculosis, tetracycline are naturally resistant to tuberculosis. Organisms are naturally resistant to tetracycline. So this type of resistance does not produce any clinical problem. But acquired resistance is the development of resistance by an organism which is sensitive to that antimicrobial before. But now, due to changes, you have exposed the animal or human to that antimicrobial agent for several times, and it takes that bacteria now to develop some mechanism to resist those antibiotics that have been circulating or being using, and resistant strain has been produced in that bacteria. If you look at it, antibiotic resistance, that is the acquired resistance, can be of two forms. It can be either transmitted vertically or horizontally. The vertical transmission of bacteria accumulate errors, as you can see from my left side. It accumulates errors or mutation in its genome during replication. That is the red resistant gene passed to the mutated and passed through other daughter bacteria that are being produced. But for horizontal transmission, it happens in three forms. Either that is the horizontal transmission can be in three forms: bacterial transformation, transduction, or bacterial conjugation. In transformation, the genes swaps from the infected bacteria to a new bacteria, which the resistant gene will be acquired from the dead bacteria and accumulated in the new bacteria. Whereas in bacterial transduction, there is what we call pages. These are transferred by pages to a new bacteria. In that way, the resistance happens. But in conjugation, it happens due to the use of a kind of sexual organ called the pilus. So this is the three forms of horizontal transmission that happen in acquired resistance. So we have transformation, transduction, and conjugation. When we talk about mechanism of antimicrobial resistance, how does these microbes now, what mechanism do they use to eject or to resist antimicrobial agent? It happens in four different mechanisms. One mechanism is by preventing the microbes, the antimicrobial agent, to have access to the bacteria. That is by producing a kind of shield that will be in between the drug and the microbe. So the microbe will produce a kind of protective layer to prevent the drugs getting into the cell, the bacterial cell or the organism cell. The second way, if the drug have the opportunity of getting into the bacterial cell, there is what we call target modification. The bacteria will modify its target, and the drug will not recognize that target to bind. If at all, now the drug succeeded in getting target, another mechanism that bacteria may develop resistance, that is the mechanism, is by enzymatic inactivation of the drug. The bacteria now, or the organism, will produce some enzymes that will destroy and deactivate the drugs. So another form of mechanism that the organism develop is by what we call efflux pump. That is to say, if the drug now have success of going through the organism, the bacteria now produce a pumping mechanism that will pump out the drugs out of the cell. So these are the four mechanisms mostly on which microbes produce resistance to drugs. Okay, so before going ahead, let us see what is happening within the Caribbean. What is the situation on antimicrobial resistance in the Caribbean? In 2022, just 2 years back, we take a survey on the rational usage of antimicrobial agent in small animal clinics and farms in Trinidad and Jamaica, two of the Caribbean countries. So in this study, we focus on clinicians, and also in clinics and farms, we take a kind of survey on clinicians and also on farms in Jamaica. And these are the basic, what we call the main findings of this research. We found out that in Jamaica, and a total of 95.2% of clinics and farms in Jamaica and 87.1% in Trinidad did not use standard antimicrobial protocols in their treatment of cases coming into the clinics. These clinicians and in these farms, there are widespread of using broad spectrum antibiotics like amoxicillin and amoxicillin clavulanic acid, mostly used in small animal practice in both countries. If you look at the percentage are high, both in dogs and in cats. Amoxicillin is used frequently in mixed animal practice, both in Jamaica and also in Trinidad. And there is a rampant use of protein penicillin also in and streptomycin, most frequently used in mixed practice in Trinidad, whereby 60% in cattle and goats, 50% in sheep, which could explain the increased risks of antimicrobial resistance. And in cases where antibiotics are required, in these clinics, microbiological analysis and antimicrobial susceptibility tests were not performed in most of the clinics. And vast majority of cases use what we call empirical antibiotics while waiting for the antibiogram. So most of our clinicians hide under the umbrella of broad spectrum antibiotics while waiting for antibiogram, which may explain the wide distribution of resistance to this. In this study, we found out that 97.1% of our respondents keep records of antibiotic prescription for each client. And the remainder of our clinician doesn't keep records. 80% of vets had animal returned for failed antibiotic treatment, which this clinician attributed to owners' lack of adherence to veterinarian recommendation and dosage intervals. And in some cases, this was also able due to antimicrobial resistance to the most frequently used antimicrobials. So in this survey, which we published in Antibiotics Journal, we found out that there are a lot of misuse of antibiotics that need to be addressed in these two countries. So what are the ways now to minimize the use of the spread of antimicrobial resistance? There are several strategies that we may employ. So we have to embark on what we call responsible use of antibiotics. We prescribe judiciously, that is to say, we prescribe after laboratory investigation, after confirmatory diagnosis, and after antimicrobial sensitivity tests to know that, yes, we are dealing with the drugs that will be used in treating the infection squarely. And we have to adhere on the normal dosage. Also, we have to give adequate frequency and time when we are treating animals. We have to avoid prophylactic use of antibiotics in farms, especially in food animals. We have to avoid using them in fattening, and we have to avoid using them in fish farms and also in poultry farm. Instead of that, we to embark on the use of natural substances like plants, which improve immunity, and also we enhance animal husbandry practices, improve animal welfare, biosecurity measures should be adequate. So we have to avoid prophylactic use of antibiotics as far as we can, because prophylactic use of antibiotic is one of the very much possible way in which resistance is being transformed from animals to humans through meat, milk, and fish products. So we have to embark on using natural plants for prophylaxis, and we have to embark on research on this plant until they are used, like moringa or oleifera. We can use it for prophylaxis instead of using these antimicrobials. So we also have to embark on research on vaccination. That is to say, although Most of the vaccine we have around now are on viral diseases. Research is needed to have more of vaccines against bacterial infection. For example, we have vaccine against Aeromonas, vaccination against Leucemia intracellularis, which is a causative agent of ileitis in Danish pigs. And this research shows that there is a reduce in the use of oxytetracycline in this organism that causes these diseases. So there is need for all this research to produce a lot of vaccines that could be used for bacterial infection also. Regular health monitoring is a surveillance program and health check are very important things that we're supposed to consider. Then a lot of seminars, education and training for farmers. We raise awareness. We inform students, young veterinarians should be involved to combat antimicrobial resistance. Regulatory measures are very important. Implementation of guidelines by government agencies. Our veterinary clinics should be provided with those guidelines, and those guidelines should be adhered to. Then we have to limit over-the-counter sales of these antimicrobials. So alternatives to antibiotics focus on 6 key areas. That is vaccine, microbial-derived products, non-nutritive phytochemicals, immune-related products, chemicals, enzymes, and innovative drugs. These areas can be focused to enhance the production of non-antibiotics substitute to antibiotics. So research should be focused on this agent to have a safe, minimize the use of antibiotics so that these antibiotics should be effective when we need them. Research and development, we have to invest in alternative therapy, collaboration and communication, engage stakeholders and share data of our research so that we know where we are and we know where we are going regarding the use of these antimicrobials. Proper waste management is very important, especially in fish ponds, in poultry farms, in piggery. Where do we dispose our waste, our water from these chickens and also wastewater from fish ponds so as to reduce environmental contamination. So implementing these strategies can help to mitigate the spread of antimicrobial resistance in animals, and also this will protect both animals and humans. Thank you so much for listening. These are my references. Thank you so much.
Okay, thank you so much, Dr. Sani, for that enlightening presentation. You presented a little bit of sobering facts for us. So moving right along, I would like to introduce to you Dr. Cadogan, our next presenter. Dr. Cadogan is a veterinarian who has worked in private clinical practice, and he has over 30 years experience covering multiple species from pets to food-producing animals and horses to exotics, including marine animals. Dr. Cadogan is a 1987 graduate of the Ontario Veterinary College, University of Guelph, Ontario, Canada. He is a local veterinary inspector for the Veterinary Services Division and has a certificate in hazard analysis and critical control point HACCP from the European Commission's Better Training for Safety Food Program 2013. He currently chairs the Board of Examiners of the Jamaica Veterinary Board. He trained as a One Health leader in the One Health, One Caribbean, One Love project. And since October 2023, he has been an adjunct lecturer in the Department of Community Health and Psychiatry, Faculty of Medical Sciences, University of the West Indies at its Monash campus, lecturing in One Health. He has assisted with UEFMS graduate student research projects that have covered giardiasis and xylosomiasis, heartworm, and cryptosporidium. Dr. Cadogan project is titled Multi-Drug Resistant Pathogens in Animals, a Case Study. Dr. Cadogan, the floor is yours.
Thank you for having me, for getting me into giving this presentation this evening. It's actually redo a bit of a presentation I gave earlier this year at the Medical Association of Jamaica's annual symposium, so modified a little bit. And so what I want to talk about is multi-drug resistance in animals, the resistant pathogens, and I'm going to get into some little case studies, case reports, and actually looking at resistance that we're finding in animal cases. All right, so let's get on with it. All right, so my outline is, I'm going to talk about the resistance levels that we have, different levels of multi-drug resistance, and looking at the European Union antibiotic categories, which I think are something that can be used as a guide for us. I'm going to speak a bit about transmission between humans and animals, get into a couple of multi-drug resistant case reports very briefly, and then looking at these cultural and sensitivity results in animals. And, just to emphasize what Dr. Sani just said, how do we tackle AMR more responsibly? All right, so first up, multi-drug resistance. Now, a definition was developed over a period of time between 2008 and 2012, and it defines it as resistance to one or more agents in 3 or more antimicrobial categories. We'll see as we go along that this is the case out there. Then you have those that are extensively drug resistant, and their susceptibility is limited to 2 or less antibiotic categories. And then pan-drug resistance as non-susceptibility to all agents in all antimicrobial categories. So we do find organisms that I think would fall into the XDR category, and maybe even PDR occasionally. All right, so in the European Union, what they've done is that they have categorized the different antibiotics that are used in human and veterinary medicine, and as a guideline for their use in animals. So they have category A, which is avoid, where you shouldn't really use these things at all in food-producing animals, but they can be used in companion animals in exceptional circumstances. Category B is restrict, and they're critically important to human medicine, and we should restrict their use in animals to support public health. And you only consider them when there are no drugs in category C or D, the lower categories that can be used based on cultural and sensitivity testing. So category C is caution. These should be considered only when there are no antibiotics in the lowest category, which is prudence, that can be effective. So the prudent category, of course, those are the first line treatment that you might, select your so-called empiricals, right? So a bit more detail on that now. And when you look at this, I'm going to try and look at it quickly. You look at category A. In terms of what we use here in the Caribbean, we don't really see much there. Rifampicin, I'm not sure if, and I know it's used in horses for full pneumonia, but I'm not sure how much it's used here in the Caribbean. But going over here, we see some of the cephalosporins. We have mupirocin. That is available as supirocin ointment or Bactroban. And we do use that at times in animals, and that's a topical antibiotic. Category B, let's see. Here is ceftiofur. We have ceftiofur in the form of Novac here in Jamaica right here now. And that's a category B drug. And among the quinolones, we use enrofloxacin, we have marbofloxacin, we use Cipro quite a bit, as an oral antibiotic in animals. So we are using these drugs that are category B, which really you have to use very, very judiciously, right? Category C, when we look at them under the aminoglycosides, let's see, we use gentamicin, that's out there. We use neomycin a lot in the oral antibiotics. Streptomycin, of course, as Dr. Sani said, combined with penicillin, use a lot of it. Tobramycin sometimes in the eye and ear drops. The aminopenicillins, amoxicillin and clavulanate, we use that extensively. A whole lot of the cephalosporins and so forth. So you see that we are using these drugs a lot, macrolides and so forth. In category D, these are the go-tos. So amoxicillin we use a lot of in companion animal practice, some in food animals as well. Tetracyclines, or the ubiquitous Oxyvet, that I don't know, every Jamaican farmer seems to have a bottle and gives to their animals. Oxytetracycline. Doxycycline we use extensively for, especially in dogs, for tick fever treatments. And the treatments are prolonged, 3-4 weeks on doxycycline. And so we go, the sulfonamides are there as well, the penicillins and even metronidazole we use. But those are category D. Those are our go-tos. So we see that, even here in the Caribbean, our use spans from category B to category D. Just very briefly, one of the good news is that globally, we have seen between 2015 and 2022 increased vaccine use and decreased antibiotic use in livestock. And the increase and decrease are pretty similar, 33% and 30%, for the reduced antibiotic use. So that's a bit of good news going along, but it's something that we have to continue. And here in the Caribbean, we have to emphasize it more. Now, looking at transmission of bacteria between animals and humans, and I do this here because everybody is always talking about zoonotic transmission from animals to humans, right? As if it's a one-way street, and it isn't. They go both ways, and some people call it a reverse zoonosis, but there's a term for it that, I don't hear used very often, but it's anthroponotic transmission. So people to animals is anthroponotic, and there are quite a few anthroponoses that we don't really talk about that much. So bacteria pass back and forth naturally, right? Without necessarily causing pathologic effects. When we're together and we interact, we exchange the organisms, right? So that brings me to some evidence of that, and that is Staphylococcus aureus. And of course, its resistant form, MRSA. Now, staph is not normal flora for dogs, and they become carriers of staph aureus when they're in contact with humans, right? So if they're in contact with humans that are carrying MRSA, methicillin-resistant staph aureus, they pass it on to their dogs and their cats too. And these pets then become carriers and then can transmit to others, especially veterinarians. There was a study done where, quite a few vets and vet clinic staff were getting infected with MRSA. And when it was investigated, it came from the dogs, and the dogs got it from their people, right? So note that the canine natural staph is Staph pseudo-intermedius, and it does have its antimicrobial resistant form, which is called MRSP. Right, so I have my little diagram here that shows that cycle between animals, people, and the environment. Okay, so this was a study done at Ohio State University where they looked at dog-owning households and tested for Staphylococcus. And they had some households, 55 households that were positive for staph, and 25 that were negative. But when you look at the distribution, there were some households where most of them were the owners only. The dogs didn't have it. But there were some that the dogs did have it. And when you look at it, you see that the dog is often sharing the pulsotypes, as they are called, with the people. In the cases here, you see a child has it and the dog has it. And down here, you see this one, two human members of the family have it, and the dog has it as well, right? So this organism is getting around that way and is getting into the dog by anthroponotic transmission. And the dog remains a carrier as long as they're in contact with people. Take the dog away from the humans completely, the Staph aureus disappears eventually, right? So anyway, so that's just to show that, it goes both ways, right? So let's move on to my first case report here, which is, this happened a few years ago, actually. And it was a pig that died, supposedly suddenly, and a postmortem was requested. They said they noticed she wasn't eating the day before, and the next morning she was dead. Now, on necropsy, there was externally a serosanguinous discharge from the nose. And then we got inside, serosanguinous peritoneal effusion, petechiae and ecchymosis in the GI tract and kidneys, congested liver, and in the chest, pleuritis and pneumonia. The caudal and ventral lung lobes were affected, and there were adhesions. So this was going on for a while. This wasn't, a sudden illness. There was pericardial effusion as well. So the cause of death would have been pleural pneumonia resulting in sepsis. Right, so here is a case of an animal that succumbed to sepsis, and it's coming from an infection that was probably there. Well, it probably had an underlying issue that was there for a long time, and then an opportunistic infection came and took over, and the animal died, right? Now, a sample of pus was taken for bacterial culture and antibiotic sensitivity testing, and here are the results. Now, we got 3 organisms cultured. One was E. coli, and 2 cultures of, well, they have it as E. gergovii, but it's actually called, no, it used to be Enterobacter gergovii. It's now Pluralibacter gergovii. Now, when you look over here, this one, the furthest right, is resistant. And when they check, that's chloramphenicol, amoxiclav, trimethoprim sulfa, tetracycline, gentamicin, norfloxacin. So they check ceftriaxone, and it turned out to be susceptible. We also have another E. gergovii that's resistant to 3 of the antibiotics in the antibiogram. Right? So this is scary. It was resistant to 6 major antibacterial preparations, right? And when you look further, when you look at the veterinary drugs that were available that could have been used to treat the pig, amoxicillin, resistant. Oxytetracycline, resistant. Gentamicin, resistant. Enrofloxacin, that wasn't tested against Enro, it was norfloxacin, but probably resistant. Trimethoprim sulfa, resistant. So there are no available veterinary antibacterial preparations that could have treated this pig had it been recognized earlier. So again, exclamation marks as far as AMR is concerned, right? So this animal had Pluralibacter gergovii. As I said, this is an uncommon coliform, and it has a tendency towards being resistant, producing extended spectrum beta-lactamase. The question is, where does this pig get it? In humans, it can be a problem in the cosmetics industry because it's resistant to the paraben antibacterials used, right? So how did it get into the pig? Did it come from the environment? Did it come from a person? Because this is not a normal organism that a pig would get. And my suspicion is that this pig probably may have had mycoplasma pneumonia, grew up with it, and it had it there at this low grade, had these lesions, was in a period of stress, and opportunistic infections took over, and it died because of it, right? But it just shows how bacteria they get into diverse places, and they are opportunistic. Now, this is another case that I had just last month, and this was a Shih Tzu with an ear infection. And this ear infection had been persisting for some time, and it wouldn't go away. Culture and sensitivity, isolated Pseudomonas aeruginosa. Now, of course, we know that Pseudomonas tends to be fastidious and tends to be resistant. But it was resistant to every antibiotic in the antibiogram. Everything, right? Actually, what I did was, the only thing that wasn't tested there was chloramphenicol. That's what I decided to try chloramphenicol drops. And the ear improved somewhat. But these little dogs with their, ear canal stuffed with hair and all of that, they tend to get these infections. And then once the mucosa, once the lining of the ear canal is damaged, it can no longer clean itself properly, so the infections tend to reoccur. Here is an organism, and this dog is in the environment, in the house with its owners, with its people, and of course this bacteria can transmit to them and can, as Dr. Sani was describing, share its information. They hold a conference and then say, okay, this is how you resist the antibiotics. And so this thing is serious. Right? Now, we're going to move along to I did a little mini study myself, just with the cooperation of some of my good colleagues who were very, very kind and generous in going and looking up in their records and sending me stuff. So I compiled some culture and sensitivity results. So it was just 4 vets, myself and 3 of my colleagues. And in terms of the bacteria culture, there were 18 bacteria cultured from 12 dogs, urine and ear swabs, 26 from 6 pigs, 12 from 4 horses, 9 from 9 cattle, 4 from 2 goats, and 3 from 1 sheep. Right. So now the antibiograms, they would vary depending on the number of drugs available, the testing and the different labs being used. Anyway, let's go on to see how it all turned out. Now, you can see here, all of the samples, total of 72 bacteria cultured, only 14 were sensitive to all the antibiotics in the given antibiogram. 57 had 1 resistant to 1, 34 had resistance to 2, and 21 out of the 72 had resistance to 3 or more antibiotics, right? 21 out of 72, multi-drug resistant, right? When you look at the species, 18 bacteria cultured from the 12 dogs, 3 multi-drug resistant. The pigs, 11 out of 26, the horses, 5 out of 12, the cattle, 3 out of 9. The goats, well, we didn't find any, just those few samples. And neither did I find in the sheep, right? But you can see the resistance is, it's almost the majority of cases have some level of resistance. So the next thing I did know in terms of analyzing is look at resistance by the drug classes, right? So looking at the penicillins, you see 2 penicillins tested, we don't really use that much. 1 was resistant. Ampicillin, 38, we don't really use ampicillin that much, but still 10 resistant. Amoxicillin, 6 out of 11. Amoxiclav, a quarter of them, 4 out of 16. And then the cephalosporins as well. Look at ceftriaxone. 17 out of 42 bacteria tested were ceftriaxone resistant, right? Gentamicin, 6 out of 34. So you're seeing resistance here to, almost all of them in the antibiograms done. Continuing, the fluoroquinolone, Cipro, 13 out of 46 had Cipro resistance. Only 1 out of 10 for norfloxacin, but we don't use norfloxacin much these days. Tetracycline surprised me, and that because it is used so heavily in our food animal industry, particularly. But I think only 9 out of 23. But then because the number of samples from the food animals may be on the low side. Right? Doxycycline, 10 out of 36, and we use a lot of doxycycline in companion animals. And this one's kind of surprised me because erythromycin at 21 out of 36, so more than half, almost 2/3, right? Resistant erythromycin, a drug that we don't really use in veterinary medicine, at least here in Jamaica, to my knowledge. We used to have the a mastitis ointment a few decades ago, galimycin, that had erythromycin, but we don't have that here in Jamaica anymore. But we're seeing a lot of resistance. So that may be coming from the human side. Who knows, right? Trimethoprim sulfa, 12 out of 32. The resistance is significant that we're seeing out there right now. And when we look at the bacteria now that are multi-drug resistant, 8 out of 13 E. coli cultures, right? 1 out of 4 Klebsiella, both of the Pluralibacter, 1 Proteus, 5 out of 8 Pseudomonas, a couple of strep, right? The only one that didn't show Enterobacter was only 1 sample, so I can't really see. But the Micrococcus, those are all cultured from horses, and none of them were multi-drug resistant. But then overall, we see the picture. Multi-drug resistance is a problem. It is out there. We are seeing it every day. Although this sample size is very limited, this is emphasizing that it's a factor in animal infections as it is in humans. And the transmission of bacteria back and forth between human and animals that are in contact with is a given. So the resistance that we're seeing in the animals has the implications, as Dr. Sani was describing, for us humans. And if you have more multi-drug resistant bacteria, the more resistant they become, it's going to increase the risk of sepsis, whether in animals or in humans. So it's something that we really have to be concerned about and try to do as much as we can about. Right? So Dr. Sani went into some of this, so I'm going to do it again just to emphasize the point. Right? You want to minimize the disease risk for animals in order to minimize the use of the drugs, which then minimizes the risk of antimicrobial resistance developing. So we need good infection prevention and control. So we need to use our good agricultural practices, right? So for farmers, they should only be giving antibiotics under veterinary supervision. We don't want them as growth promotants. We need to use more vaccination and apply the good practices at all steps of production and improve your biosecurity. These are the gaps that the World Health Organization put forward, right? And us vets, we only prescribe and administer antibiotics when necessary at the correct dosage for as long as necessary, and with veterinarians client-patient relationship, right? Prescribe or dispense the drugs only for a specific treatment course for an animal or group of animals, and not for discretionary use by the owners. Or the farmer has a bottle of antibiotic there that they use when they want to. Right? We're going to have to try and reduce that as much as we can, right? As much as we can prescribe based on bacterial culture and sensitivity, although that is difficult. You have an animal with an infection, you need to do something now. The culture is going to take maybe a few days to come back, so you have to treat empirically. But then, sometimes we have the challenge because owners are not going to pay for our culture and sensitivity every time. And so we just have to do the best we can. And then also in veterinary medicine, minimizing the use of drugs that are critically important in human medicine. And of course, education, Dr. Sani talked about that, and observing the withdrawal period for animals. The farmers need to know about that and need to understand the importance of it, right? The veterinary drug distributors have to be responsible as well and distribute the antibiotics only to registered veterinarians or under prescription of a registered veterinarian. And these prescriptions should only be processed by a registered pharmacist. We can't have antibiotics being sold in farm stores by farm store clerks who don't know anything about it. And that has been happening, right? It's kind of coming more under control now, which is a good thing, but we have a long way to go. And of course, the regulatory authorities need to strengthen our legislation, monitor the sale and distribution of the veterinary drugs, and promote and support the good agricultural practices. So we must fight AMR and sepsis together, because as we say in our One Health conference, together we are stronger. All right, so I have to acknowledge my vet colleagues who provided some of the culture and sensitivity results. Dr. Eitel from Phoenix Vet Care, Dr. Michael Mota, Dr. Jason Wright, got some help from Dr. German Vasquez of CariVet and Dr. Walker at the Vet Services Division, Dr. Ellis from VSD as well, and Prof. Armando Hoyt from Ohio State University, who gave me the information on the staff. And there's my references, and that's it. I thank you very much for your attention. And now I guess we can move to the Q&A if there are any.
Thank you, Dr. Cadogan. Some very sobering facts, scary and sobering facts were presented in your presentation. So yes, we are now at the question and answer session. I see there were several comments and I saw one question. Please feel free to put questions up. So I'll start with the first question, and this is from Dr. Sandeep Miraj, and his question is, what is the role of the pharmacist in this? I saw the question was posted during Dr. Cadogan's presentation. So I guess we'll start with Dr. Cadogan. What is the role of the pharmacist in this?
Well, of course, the pharmacist is one of the educators. Of course, they're filling the prescriptions that veterinarians and physicians are writing. So the pharmacist here is going to need to educate the patient or the client on, one, the responsible use of the drugs, that this is your prescription, this is how much you're to give. You must take the drug for the prescribed length of time. Don't stop beforehand, to consult with your doctor if it doesn't seem to be working, right? And also to help safeguard that the whole issue of dispensing drugs only on prescription, especially in some of the where the veterinary drugs are concerned. Because one problem that we had here in Jamaica, I don't know how extensive it is now, but it was very extensive in the past, was the farm stores. And there was a time many years ago where drug reps from the distributors used to go to farmers to sell the drugs. I used to have farmers coming to my clinic with a bottle of injectable drug. Doc, how I'm to use this, right? And that was because the vet sector is so small, and the companies, they need to get their ROI, get their return on investment in bringing in these drugs. And if they sit there and they're not being bought enough by the vets, they sit and expire. So they need to get them out there. And then they were getting into farm stores where prescription drugs just there on the shelf, right? And anybody can go in and just buy it. And that has been clamped down on, more and more in recent times. Still that distribution and not to have these drugs in a location that is easily accessible. I know the farmers will complain and cuss, because they say, oh, you're trying to take away the drugs from us, and we need it to treat our animals because we can't get no vet, right? Or they can't afford the vet. But still, that can't be acceptable in our situation where, with what we are facing, both for public health, for animal health and welfare, we have to take control of this. So, I mean, pharmacists have a big role in educating. I don't know how much role they would have in policing the pharmacy council or something, have in policing the distribution of the drugs. And when they get into stores that don't have a pharmacist, which really is illegal, but then it still happens. That's what I have to say about that. If Dr. Sani has any comments.
Sani, do you have any comments on Dr. Maraj's question? So Dr. Maraj did go ahead to refine his question, and he said when it comes to monitoring antibiotic use, which Dr. Cadogan did address at the end, but Dr. Sani, do you have any comments on the role of the pharmacist when it comes to monitoring antibiotic use?
Dr. Cadogan has said a lot. Pharmacists can play a very good role in documenting this prescription by the vet, so that they can trace who submitted this prescription to their pharmacy. In that, they will be helping the veterinarians to know from which vets these prescriptions are made. So as a kind of double check-in on who is prescribing what. So with time, they will be able to help the veterinarian the amount of broad spectrum antibiotics that are being prescribed all over, so that this data will go along in helping the veterinarians to streamline their prescription.
Thank you, Dr. Sani. We have another question from Emilio Hales, and the question is, would having seminars to educate the farmers go far to help reduce antibiotics resistance? I guess we could probably start with Dr. Sani here, and then probably Dr. Cadogan can give a comment.
Thank you so much, Doc. That is a very good question. This can help and go a long way in preventing antimicrobial resistance, in the sense that these farmers will be educated, especially in terms of prophylactic treatments. A lot of farmers use medicated feeds. A lot of farmers use this for growing factor on their farms, using medicated feeds every time, using broad spectrum antibiotics for prophylaxis. So this area has to be tackled with necessity, so as to cut down the broad spectrum antibiotics that are used for prophylaxis in our farms. In fact, I am advocating zero use of prophylactic treatment in our farms. So this will go a long way in bypassing antimicrobial resistance if these farmers will be educated to use natural products, which I know a lot of research is going on in the universities on the use of natural products, plants, and other nutraceuticals as used in boosting immunity and also for improving growth and protecting animals from contracting this bacterial infection. So this seminar should be organized in educating the farmers what to use naturally for prophylaxis, not antibiotics as per se. So I think it's a very good move to involve these farmers and educate them on alternatives to the use of antibiotics, especially for prophylaxis.
Yeah, I agree completely. And this is something that has to be ongoing because, you know, they hear something once and then, you know, it's forgotten in a short while. I know that, of course, I do believe that here in Jamaica, our broiler companies are not using antibiotics. The only thing that would be in the feed would maybe be coccidiostats. And of course, I know they're moving towards actual coccidiosis vaccines now to try and eliminate the use of the coccidiostats. For the human health professionals in the WHO, coccidiosis is a serious problem in poultry and other animals too, caused by Eimeria species, protozoa Eimeria. I don't think humans get coccidiosis. We use coccidiostats to prevent the animals from coming down with it. So we're trying to reduce that use, but also, you know, farmers for them to understand that not every time an animal is sick that it needs antibiotics. The animal looks droopy. Oh, me give him a shot of antibiotic, you know, and when they have it, that's what they'll do. And it's not just in food-producing animals. Just the other day, I had a client come in with their puppies and informing me that the puppies, they normally give every litter of puppies a course of trimethoprim sulfur, you know, when they're about 5 weeks old, you know, for prevention, I guess, coccidiosis prevention, as well as prevention of other infections. I think it will help prevent parvo. But I said, what? No. And I explained to them why. You know, so this idea is out there, and sometimes I don't know where the persons are able to access the drugs. You know, sometimes I have to say to them, because we're all in this together. We all share responsibility, because I know there are pharmacists who, you know, their friend come and ask them, and they will give them the drug. So the pharmacists too have to be responsible, as well as the veterinarians. And of course, the education part, you know, we have Antimicrobial Awareness Week coming up in a couple of weeks' time. And I know that, you know, there are seminars and stuff that go on, but it's just to reach everybody so that they understand. I see a question here.
Yeah, there's one from David Elcock.
Yes, that's what I was looking at.
Is this for you, Dr. Cadogan? What is the way forward to minimize or optimize drug use in animals, and is there a role legislation must play?
Well, we're not going to eliminate use, because, you know, animals are going to get sick and they're going to need antibiotics, but just it's the judicious use. And, you know, as I said in the presentation, you know, eliminating the prophylactic use, increasing vaccinations, because say in the pig case that I presented, you know, that particular farm, they don't vaccinate. Maybe if the pigs were vaccinated for mycoplasma when they were young, you know, a case like this would not happen. But, you know, sometimes they just don't understand the role of, you know, that kind of prevention. You know, the farmer has this mentality: animal sick, come quick. They wait till the animal is sick before they try to do something, right? And neglect the whole. Maybe they need more education on the role of vaccination, on infection prevention and control, the sanitary measures, that kind of thing. And legislation is important too. We need to strengthen our legislation, because, you know, that can help with control. You know, so that's something that we have to look at together.
I agree with you.
Another question for you, Dr. Cadogan. It's from Marie Bailey, and she's asking, would the symptoms from an infected animal who interacts with humans present itself in a similar way?
Well, not necessarily. It depends on what type of infection there is. There are some diseases, like say an animal has E. coli diarrhea, and the farmer who is working with it gets contaminated with that organism, they could contract the same kind of diarrheal disease. And say you have an animal that has an infected wound, you have a little scrape on your skin and don't realize it, and the bacteria from that wound, if you are treating it, can cause an infection of your own wound. But then, the bacteria that are just there naturally, the normal flora that are on the skin, in the mouth, passed in the feces, can transmit to us and don't necessarily cause us to get sick, but we're still carrying them. And if, as I said before, if there is antimicrobial resistance, then they can transmit that resistance to the other normal flora that's in our bodies. And then when something happens, another thing to remember too is that bacteria are opportunistic. That normal flora that you have in your digestive tract, on your skin, they're kept there by your immune system and they have developed that relationship. But if something happens that breaks that down, then they can actually get in and cause infection. So that's what happens, say, with parvovirus. The parvovirus does so much damage to the intestinal tract that the normal flora bacteria can end up getting into the blood, right? And you get bacterial sepsis from that, which can kill the animal. Example, ear infection. But again, not necessarily, because if you have a dog, like say the dog that has a resistant Pseudomonas, you could get a wound infection if you're handling the dog and the bacteria get on you, and then you have problems treating it. So it's complex.
All right. Well, unfortunately, we have to bring the evening to a close. I think we could probably go a few more hours talking about it. But just before we close, I'd like to ask the both presenters, do you have any final comments you'd like to bring to our audience? We'll start with Dr. Sani. Any final comments?
What I want to emphasize here is that it's high time now we move from prophylactic treatment to development of vaccines and also boosting immunity of animals to replace prophylaxis use of antibiotics. There is need for more research on natural products that we can use in boosting immunity of our animals, especially in our poultry farms, broiler farms, and also in small animal practice, so as to have this natural product that will work in boosting immunity and also working hand in hand in producing vaccines that will replace the use of some of these broad-spectrum antibiotics, as Dr. Cadogan just highlighted. So I think it's high time now for us to shift from our traditional way of prophylactic use of drugs to vaccines, and also using natural product in boosting immunity and for prophylaxis. Thank you.
I agree there. And, didn't really mention it specifically, but, increasing the use of probiotics and prebiotics can help reduce the need for antibiotics. There are a number of probiotic preparations out there, and the prebiotics too, that we use here in Jamaica, that they use it in the feed now, and it's there for livestock, but I use it in dogs, use it in puppies. And when it's used, the incidence of parvovirus seem to be controlled. It's reduced, because you help that to balance that gut microbiome, which is so important in natural immunity. But just to close, I see somebody asked, and one more question, which I would love to answer because it's one of my pet subjects, asking about dogs getting ehrlichiosis, and can that pass to humans? The answer is that depends on the type, right? Ehrlichiosis, there are some that can infect humans. Ehrlichia canis generally doesn't, right? But of course, people get bitten by ticks, and there are a number of infections that ticks can carry. Ehrlichiosis is generally treated with doxycycline, whether in humans or in animals, as far as I know. I hope that answers the question. And I just want to close by saying, yes, AMR is real. AMR is all around us. And, it's, as it's said globally, it is an existential threat. Because if we get to that point, we will not be able to treat the infections that we took for granted that we can treat, and it can be a disaster, right? So take it seriously.
Thank you, Dr. Cadogan. Well, this brings us to the end of our first veterinary webinar for the Caribbean Sepsis and AMR Alliance group. I'd like to say thank you very much to our speakers. You presented a lot of information. I'm hoping, within the One Health, that people who are not veterinarians have now a good idea of what we are dealing with in the veterinary world, and we realize that we probably have the same problems, whether we're in veterinary medicine or we're dealing with humans primarily. So thank you very much for that enlightenment. And it shows a lot of areas also that we have for research and a lot of collaboration moving forward. I'd like to thank Marketing and Communications for facilitating us, for helping us set up this webinar, Ms. Maynard and Ms. Chanel. Thank you so very much for facilitating everything, for handling all the background. And of course, last but certainly not least, Dr. Satish Janki. He did a lot of the work of putting it together. He's the one who's been propelling us since we launched in May this year. He's done a lot of work to get us on board, to get us very excited about doing these webinars, and we thank him very much for this. To our participants, thank you for taking time from your busy day, almost close to Christmas, to spend some time with us. We look forward to having you for any future webinars we may have. Thank you and have a good night.